how is Ehlers-Danlos syndrome diagnosed? And the answer to that question really depends on the type of Ehlers-Danlos syndrome. There are 13 different types of Ehlers-Danlos syndrome, and we know the genetic cause for 12 of those types. But the most common type, which is called the hypermobile type of EDS or hEDS, is the only one for which we do not know the underlying genetic cause. So if our clinical assessment suggests one of the 12 types for which a genetic cause is known, we can make a diagnosis by doing genetic testing. And this is typically done with what we call a buccal swab or a cheek swab. The DNA is isolated from the cells on the cheek swab and can be analyzed for the presence of pathogenic variants in the genes that cause those 12 known types of EDS. But if in our clinical assessment we really think the most likely diagnosis is the hypermobile type of Ehlers-Danlos syndrome, our diagnosis depends on meeting the clinical criteria for hEDS, which were put forth in 2017. And these include generalized joint hypermobility, the presence of 5 out of 12 features that are commonly seen in hypermobile EDS, the family history of hypermobile EDS in a first-degree relative, or the presence of complications of joint hypermobility, including pain and instability in the joints. And finally, we really have to make sure that we've thought about all the other possible diagnostic options for this person. And if there's any suspicion that it could be one of the other types of Ehlers-Danlos syndrome or another hereditary disorder of connective tissue, typically we will do genetic testing to exclude those other possible diagnoses.